So, good day everyone. My name is Ivy C. Cabilin, a student nurse from the University of Mindanao. So for today's video, I am going to perform a IV therapy which includes IV infusion, regulating flow rate, and discontinuing IV solution.
Here are the step-by-step process of the procedure of IV therapy. So the first process is starting IV infusion. The first procedure is to check the doctor's order and make an IV label. This to ensure that the client receives the correct IV solution and medication as needed as ordered by the physician. The second procedure is wash hands. This prevents the spread of microorganisms. Third is to gather all the equipments and prepare the IV solution and tubing. Having all the equipments available saves time. Maintain aseptic technique when opening sterile package and IV solution. This to prevent the contamination of IV solution and set which can infect rapidly the client. Check IV tube for kinks because kinks or bends in tubing may decrease or stop the flow of IV fluids. Clamp tubing, uncap the spike and insert it into the entry site of the bag or bottle as the manufacturer directs. If an additive is ordered, incorporate it before inserting the spike into the entry site. This punctures the seal in the IV bag or bottle. Suspend the IV solution on a hook in the preparation area and press the drip chamber and allow it fill at least halfway. Suction effect causes fluids to move into the drip chamber and also prevents air from moving down the tubing. Remove the cap at the end of tubing. Release the clamp and allow the fluid to move through the tubing. The term for this is priming the tubing. Allow fluid to flow until all air bubbles have disappeared. Close the clamp and recap the end of the tubing, maintaining sterility at the setup. This removes air from the tubing which can in larger amounts act as an air embolus. Notify the nurse or the physician who will insert the IV. When he or she arrives, bring preparation to the bedside. Facilitates accomplishment of the task. Identify the client and explain the procedure. Explanations allays the client's anxiety.
So good day ma'am. My name is Ivy C. Cabilin, your student nurse for today. So I am going to perform a IV infusion.
Have the client in a supine or low Fowler's position in bed. The supine position permits either arm to be used and allow for good body alignment. The low Fowler's position is usually the most comfortable for clients. The tourniquet to the doctor or nurse followed by a cotton balls with alcohol and needle or vasocan. Observe while the doctor or nurse is inserting. Anticipating the needs of the doctor is one good characteristic of a nurse. The tourniquet when he or she indicates or when a return flow of blood to the adapter is observed. The tourniquet causes increases venous pressure resulting in automatic backflow, an indication that the needle is inserted into the vein. Next procedure is to connect the tubing to the needle. Is to start the flow of solution promptly by releasing the clamp on the tubing. Examine the site for signs of infiltration. Blood will clot readily if IV flow is not maintained. If the needle accidentally slips out of the vein, solution will accumulate and infiltrate into surrounding tissue. Next is to support the needle with a small piece of gauze or tissue paper under the hub, if necessary, to keep the needle in place. The pressure of the wall of the vein does not offer resistance to the movement of the needle. The weight of the tubing is sufficient to pull the needle out of the vein if it is not well anchored. Loop the tubing near the site of the entry and anchor it with plaster to prevent pulling of the needle. The smooth structure of the vein does not offer resistance to the movement of the needle. The weight of the tubing is sufficient to pull the needle out of the vein if it is not well anchored. Anchor the arm to an arm board for support if necessary. An arm board protects against change in the position of the vein and acts as a reminder to the client to minimize arm movements. Next is to adjust the rate of flow according to the doctor's order. The physician prescribes the rate of flow. The next procedure is to complete the label and tape to the IV fluid bag or bottle. The next procedure is to do the aftercare of the equipments and wash your hands. Deter the spread of the microorganisms. The next procedure is to document the procedure and the client's response. Chart the time, site, device used, solution, and rate of flow, and the physician or nurse who inserted the needle. This provides accurate documentation and ensures continuity of care. And the last procedure is to monitor periodically at least every 30 minutes to check flow rate and observe for infiltration and other untoward symptoms. This documents the client's response to the infusion. The second process is regulating flow rate. The first procedure of regulating flow rate is to review accuracy and completeness of physician's order and client's medical record for client name and correct solution. Type, volume, additives, rate, and duration of IV therapy. Follow 10 rights of drug administration. This to ensure that correct IV fluid is administered.
So excuse me ma'am, can you please avoid unnecessary movement, especially to your injection site, because it can cause backflow of the blood and it can affect your flow rate to your IV solution.
Third is to perform hand hygiene. Inspect IV site for signs and symptoms of IV-related complications such as pain, swelling, or redness. Observation or reports of any IV-related complications indicate need to re-establish patent IV access. Next is to observe patency of IV tubing. IV line must be free of kinks, knots, and clots for fluid to infuse at proper rate. Next is to identify client risk for fluid and electrolyte imbalance. Given type of IV fluid, example neonate, history of cardiac or renal disease. This helps prioritize assessments. Volume control needs to be strict. Guides choice of infusion device.
Excuse me ma'am, can you state your name po?
Cara Dinero,
When was your birthday po?
July 28.
Can I check your ID band po? Okay, Miss Donaire.
Next procedure is to have paper and pencil or calculator to calculate flow rate. Use mathematical calculator or cycle to obtain correct rate. Next is to check patency of the IV line and needle. Any interference with the patency of the IV line will influence the IV flow rate. Next is to count the drops per minute in the drip chamber. Hold the watch beside the chamber. Holding the watch next to the drip chamber allows the eyes to focus on the drop and the second hand on the watch to provide an accurate count. Next is to adjust the IV clamp as needed and recount the drop per minute. This regulates the flow rate into the drip chamber. And the last process is discontinuing IV infusion. So the first procedure in discontinuing IV infusion is to check the physician's order for discontinuing IV fluid. This to prevent inadvertently discontinuing the IV and having to restart it. Second is to wash hands and assemble equipment. Having all equipment available saves time. Next is to identify and explain the procedure. Explanation allays the client's anxiety.
So ma'am, based on your doctor's order, I am going to discontinue your IV infusion because you are ready to discharge and your condition is stable po.
Next procedure is to don gloves and clamp the infusion tubing. Clamping the tubing will prevent the fluid from flowing out of the needle on the client or bed. Next is to hold a swab above the venipuncture site. Withdraw the needle quickly by pulling it out along the line of the vein. Pulling out in the line with the vein prevent injury at the vein. And after that, immediately apply firm pressure at the site using the swab for 2 to 3 minutes. Pressure helps stop the bleeding and prevents injury at the vein. Next is to discard used supplies appropriately. Remove gloves and wash hands. The dressing continues the pressure and covers the open area in the skin, preventing infection. And the last procedure is to record the amount of fluid infused on the I&O record sheet and on the chart if necessary. Include the type of solution used, time, and reason for discontinuing the infusion and the client's response. This ensures accurate documentation of client's response.